Hey everyone, I'm Dr. Kalie Reams. I'm going to be showing you manual lymph drainage for the left arm. This is my left ring finger, right? Left side. I know it's opposite when you're looking at me. This is a general description. This is more of like preventative or if I see you and we go over this, right? But very often I modify based on what someone has. So take that as it is, right? So manual lymph drainage is designed to help guide fluid to healthier lymph nodes. It's the whole purpose of it. We want it to be very light. So if you can see, I'm just moving my skin. I am not giving myself a deep tissue massage. That deep tissue massage causes more fluid. So we want to stay light, only moving the skin. Okay. The next thing to understand is where these healthy lymph nodes are. So if it was my left arm that I had radiation, lumpectomy, lymph node dissection, whatever I had here, right? My healthy lymph nodes are going to be in my neck, my right arm, and my left hip. Okay? So we are going to try and pull the fluid to those healthy lymph nodes, all of those other sections, so we don't overwhelm another one. Okay? To help with the impacted area. So the first thing we're going to do is right at the collarbone, okay, right underneath of it, you're going to do light strokes. Now you can see on my shirt, it barely moves. This one, I'm just kind of saying, hey, wake up, okay? Not even moving my skin on this one, just a gentle wake up motion. On all of these, we're going to do about 10. I'm not counting, so don't hold me to that during this video, okay? Next, there is our collarbone right here, and that tight muscle we all get really bad knots in. There's a soft spot in between it. I want you to find on either side and just gently press down, okay? You can see my skin just kind of move. I'm not choking myself. I'm just gently pressing down, telling the lymph nodes in that area to kick into gear. They're working, but we want them to work a little harder, okay? So about 10 presses there. Okay, now because it is my left side, I technically only need to do the left side here. I like to do both just as a precaution, but if my hand goes on the side of my neck, you can see just below my ear, just above the shoulder, right? Now you're going to move the skin back towards your spine and then down towards the shoulder. I'm doing it a little bit more aggressive so you guys can see the motion, but really it just kind of looks like this. Okay, just enough to move the skin. If you look closely right here, you can see my skin moving. So essentially what I'm saying is all of the fluid sitting in here, let's make sure these lymph nodes are kind of kicking it into gear. So what it looks like on both sides is like this. Now I cross my hands because this is really awkward on my wrists. Back and down, back and down. Again, about 10 of these. 10 is not some magic number that when you get there, all the fluid's gonna be working. It's just basically do more than 2, but don't sit there all day, okay? So about 10. Now, again, my left side, I go from the tip of my shoulder, right, on top. Now I'm going to be working towards my neck. So I want to pull some of this fluid towards that area we just kind of kicked into gear, okay? So again, we're going to push back and then towards the neck. So we're always going to be going perpendicular, then towards the lymph nodes we want to pull the fluid towards. So if I'm coming to these, I go perpendicular towards, kind of that L shape, right? Now my hand is moving, so it takes me about 3 strokes to get from my shoulder to my neck. Everyone's different, so don't just count 3, okay? Back and towards my neck, back and towards my neck, back and towards my neck. We're going to do this about 10 times. Now it only counts as 1 once you get to the neck, okay? And you can kind of see my shirt slightly move, right? Because I'm pulling my skin, but I'm not yanking my shirt all the way up in my armpit, okay? Now this does work best skin on skin. I want this video to stay on YouTube, so I'm not going to show you skin on skin, okay? This can be done sitting, laying down, in the shower, wherever you find time and feel most comfortable, okay? For the purpose of this video, I'm doing it sitting so you guys can see. People can help you with this. You do not have to do it yourself, but if you're independent like me, I would do it myself. But there is flexibility there. Okay, that's roughly 10. Okay, so now we're going to go to my right armpit. Okay, my hand is up in there. I just put on deodorant, so I'm good to go. Now, we're kicking these lymph nodes into gear. Remember, this is another section of good ones, right? So I'm going to pull across and up into the armpit. Okay, that's exaggerated so you can see. Really, it looks like this. I don't need my shoulder up in my ear. Just moving the skin, okay, across and up. If you notice, my hand is pretty flat. I'm doing a whole motion. I'm not gripping on, okay? So if you look, I'm like this, okay? Not grabbing onto anything. And again, about 10 of these, okay? So again, telling the lymph nodes, kick it into gear. We're going to be pulling some fluid towards you, okay? So roughly 10. Now we want to pull the fluid from the left to the right. Okay, so that same perpendicular towards. So I'm going to start over here. I'm going to pull up and then towards my right. Up and towards my right. You can kind of see that little pull on my shirt, right? When I get to my sternum, my wrist starts to get funky, so I can switch hands. Okay? You got to do what's comfortable for you. This is how I like it. But I want you going from that left armpit to the right armpit. That same L shape, pulling across. Okay? Now, some of you may have had a double mastectomy, may have had cancer on this side, and then later on this side. This is where things change, okay? So if that's the case and you have a different situation, reach out to a local lymphedema therapist in town or email me, right? And I'm able to help you. If you're here in Chattanooga, set up an appointment with me, okay? Or surrounding areas. I do travel. And again, this is 10 once you make it across, okay? So I don't think I've done quite 10 yet, but for purposes of this video, I'm going to move on, okay? So we've done the neck and the armpit, okay? Now we're going to come down to our left hip, okay? So my hand, if my hip bone is right here, right? My pubic bone is right here. My hand is kind of lying in between along that bone there, okay? Just going to go down and then up towards my belly button, okay? 10 times. Again, just moving the skin. I am not massaging my bowels, okay? I'm not trying to scrape out all the gunk down in there. Just the skin. And about 10 of these, we're telling these lymph nodes kick into gear, so we're about to pull fluid towards you. There we go. Okay, that's about 10. So now we're pulling fluid towards those, okay? So we're going to start in that left armpit, and we're going to be moving down our side to kind of that hip area, okay? I'm sure you figured it out by now, but we're going to go perpendicular towards that nice L shape, okay? So that's where that hip was that I was doing that massage, right? Perpendicular towards. Those of you who have larger chest, right? It may help if you're laying on your side to get the boob out of the way. Find what works for you, okay? And you do not have to be way on your back. That's not what I'm doing. I'm generally on this side because a lot of the fluid likes to sit right in here, okay? And I am even on the side of my chest. That's part of it, okay? Down to that hip. And again, it only counts as 1 once you do the whole section. So 10 of these. Just moving the skin. My hand is flat. I'm not gripping on. I need my hands, so I'm not going to wear them out, okay? We don't want deep tissue massage. We don't want to cause more fluid. If you guys have ever gotten a massage, the massage therapist should have told you, and I hope they did tell you, to drink an extra glass of water because it causes a fluid response that you drain out more. And so we don't want that. Now, where does all this fluid go in that we're moving, right? Well, it gets processed through the lymph nodes that filters out the gunk and the water, right? And a lot of that water gets put back into our system, but any excess goes to the kidneys and we urinate out. So if you're going to the bathroom more after this, good sign, okay? We're getting a lot of that fluid out of there. So keep that in mind, that you may be going to the bathroom more. All right, that's roughly 10, okay? So we've now done the trunk and told the other lymph nodes, pick up this extra fluid. So now we're gonna move to the arm, okay, and pull the fluid out of there because we cleared the upper pathways, okay? So if I divide my arm into 4 sections, right? So I have upper inner, upper outer, lower inner, lower outer, okay? So I start on upper inner. So there's the bend of my elbow, right? Start right here. I'm gonna go perpendicular towards, we're trying to pull it up to our trunk so it can then go to our neck, armpit, or our hip and be reabsorbed, okay? So across and up, across and up. Okay, that was 1. There we go. I hope this is making sense. Good. good. All right, I'm not going to do 10 on these because these are pretty easy to see. Now I'm going to go to the back of the arm. Okay, so across and up. At this point, you should know this motion, right? Because you've done it several other places on your body. And again, my arm, you can see I'm not white knuckling it. I'm more so using this part of my hand, okay, to move that skin. Now this, especially if you have swelling sitting in your arm, as you go, you'll probably be able to feel some of that fluid softening. If that's your case, that's a good sign. That's what we want. And so when I'm working on people, if they have a lot of swelling kind of sitting in through here, down here, I don't count to 10. I go until I feel the fluid really soften, and even a couple after that to make sure I got it, okay? So if that's you, feel free to do that. All right, so there's that. So now I'm gonna go to the inner arm, lower arm, and go here, okay? So that same perpendicular towards the armpit, perpendicular towards the armpit. And I'm gonna go all the way up the arm. Some individuals, if they don't have a lot of swelling or this is prevention, I tell them to stop at the crease of the elbow here. It's really independent. For preventative purposes and to give it a little extra kick, going all the way up the arm is not a bad idea. It's not that much more time. But again, varies person to person, okay? Perpendicular, and you can see my hand is pretty relaxed. My fingers are not curled in or digging in. I need my hands, I can't wear them out, okay? Same thing with you guys, or you ladies, I should say. Some men get this, but more females with that breast cancer related. All right, so now the back of the hand, okay? Some people get swelling down into the hand, so I'm gonna show it even down on the hand. If you don't have any swelling there, you can start at the wrist, but I'm gonna show from the hand. So that same perpendicular towards the armpit, okay? Again, I'm going all the way up the arm just for that added benefit. And do that about 10 times, okay? So that is manual lymph drainage, okay? Now, if you have a lot of swelling and this is something that I've taught you or someone else has taught you, you want to follow it up with compression. So if we're working on getting the swelling out, that means compression bandages. If this is more of a maintaining your decreased fluid, that means you're compressing sleeve or glove, okay? Those are very, very important because we pump fluid 24 hours a day. You don't want to be massaging yourself 24 hours a day, so the compression helps keep the fluid out. So if that is something you feel like you're missing, reach out to your local lymphedema therapist. Email me if you're in Chattanooga. Reach out. We'll get you set up so that we can get you in some compression, okay? The other piece here is follow up with some exercises. Our muscles are a natural way to pump the fluid out. So even if it's wrist curls, elbow curls, some shrugs, right? Very, very important. One key piece that I always forget to mention during the massage is diaphragmatic breathing. Our lymph system starts from deep within and the fluid slowly makes its way out. So if we can get a good pump kind of kicking this into gear in the beginning, that's what we use diaphragmatic breathing or deep belly breathing for. So if you're sitting back, you put one hand on your lower belly, right? So if my belly button's right here, I'm kind of just below it. There's my belly button. One hand on my chest. If I breathe in, you should see this hand moves, right? This one, not so much. So that is a natural way to kind of massage the inside lymph system to kind of be giving a push from behind for this outer lymph fluid. Doing about 10 of those breaths. Do not hyperventilate. If you start to get dizzy, do just a couple, take a break, and then a couple more, okay? That is something very good to work on throughout the day. You can do diaphragmatic breathing just sitting up normal, but it's easier for you to see when I lay back, okay? All right, I hope that was helpful, you all.